Doing? We're in the middle of a hair transplant, and we have a gentleman here who's very young, 75, who is very handsome and feels young, but feels like his receding hairline is giving him away. So we're going to rejuvenate that hairline. What I'm doing right now is I'm calculating how we're going to do the hair distribution to make a very natural appearance. And the way we do this is we're not trying to replace the entire scalp. That's impractical. What we're trying to do is frame the patient's face and give him a more youthful appearance, give him a virile look. And it's very important that we approximate the grafts in such a fashion as to give the illusion of a dense hairline, but yet a natural hairline. And right now I'm making the map of how we're going to put the grafts. The hairs can come out from the harvest site, as you can see.
Something I've never had no kissing. Oh, what I've been missing.
We've just loosened up the hairs, and now we're harvesting the hair plug. And as you can see, you have a hair surrounded by some supportive tissue. And what will happen is we'll delicately separate out these hairs of supportive tissue, shown one. And as you can see, can you zoom in on that? As you can see, there's the black hair shaft surrounded by supporting tissue. We'll delicately reimplant them to create our hairline. Now, as you can see, there's no scar. Each little individual hair has a very microscopic circular extraction pattern, less than a millimeter. This will heal very quickly. Approximately a week, there'll be no evidence that hair was harvested. There'll be no scar. The patient will be very comfortable. Can you zoom in on that? Zoom in on that. That's a good one.
Tough.
At the moment, I am separating the grafts that Patrick has just sent over my way. Today for our grafts, we're separating, we have grafts with 1 hair, 2 hair, 3 hairs, 4 hairs. So right now, also we have short and long. So I'm separating by length, and then I'm going to separate by clusters as far as 2s, 3s, and 4s. For this gentleman, we're going to sort out 1s and 2s, and then 3s and 4s, and then they can be put in the proper locations. And that's what I'm doing.
It's okay.
So they're inserting the grafts into the hairline right now. And he takes each individual graft, which are sitting there on his finger, grabs them, and inserts them into the graft site. This is all done individually and with care not to damage the follicle. They have to be facing the correct way, and the very end has to be sticking out. Go.
Now, you'll notice this gentleman is about 75 or so, and you might say, well, how do we know what to do with the patients of different characteristics? And over the years, you kind of develop an idea of what the hairline should look like and the hair should look like on the certain ages of the different patients. Now, this patient here is a little bit older, he's very robust. We have to keep him that way. What we're doing is we're constructing a hairline that's appropriate for his age. It's set back the proper amount. It's got the proper amount of hair graft density. In other words, we're making this gentleman have the same hair density as the rest of his head, so it's not conspicuous. He's going to have a natural, healthy look, and we're going to be able to make the most of our hair grafts, and we're going to make the most of his time in the operating room and make his recover as easy as possible. Thanks for joining us. This is Dr. Martini once again. This particular patient represents a very specific case of an elderly, robust gentleman. We've individualized the care plan. We individualize where we place our grafts, how we gather the grafts, and in the coming months you'll see his outcome as well as other patients of different ethnicities and ages, and you'll get to see that hair transplant truly is an art, and we must focus the patient's characteristics. We must focus on their needs and desires and be very realistic and practical about what we can accomplish for each patient. But in the end, it usually works out and the patient's quite happy.
Hello, my name is Vince. I've been a home builder for 50 years, and I decided to get this procedure done. I was so impressed by this company that when I got home, I made some notes, and I'm sort of going to read them to you now. The staff was well informed and extremely helpful and totally in control of the process. I had very good results. I had my head done yesterday, and there's going to be a picture of it one day later after the surgery. Replenish is located a very short distance from I-95 on Route 40 in Elkton, Maryland. I came from Delaware County after hearing about this company and set up a visit and got the process done. The building is plenty of parking, easy to find, and no steps anywhere for the elderly people, so I recommend it that way. I personally endorse this procedure and Replenish Company.
Thank you for watching this video. For your own personalized consultation and for your own personalized evaluation, feel free to contact us for a consult. Also, feel free to see our website and other materials that might help you form some ideas before you come see us.